Hi there, and welcome to Dr. Carri's Clinical Corner. Today, I'm going to talk about what happens in a pelvic floor physical therapy initial visit. I made a video on this a while back, but I just want to update it. A little bit better sound and lighting and video quality. So this is what I do. I can't say this is what happens across the board, but at my office, when you come in, we're going to spend as much time as we need talking about your symptoms, your story, your medical history, what's going on. So I definitely make a lot of time for that, the whole story, so you don't feel rushed. And then we're going to do an assessment. And so I might start with looking at the flexibility of your spine, looking at the strength of your hips and your legs. I commonly do that, but not all the time. And then the pelvic part is what people want to know about. So I tell people you always have the option to say yes or no to any part of this. Nothing is mandatory. So if you don't want to do a pelvic exam, you don't have to. If you say yes and you change your mind, that's also okay. So doing a direct pelvic exam is the way to get the most direct information. But a lot of people don't want to do that. And so we can work around that and we can get information other ways. So it's always 100% up to you, and you can always change your mind. So let me show you on a female model. So here's the pelvis, and then here's the pelvic floor muscles. So all the red is pelvic floor muscles. So typically what we'll start with is me doing a pelvic exam, so one finger. I always tell people like the pelvic floor muscles are about 1 or 2 knuckles. So if we look from the inside, I want to sort of feel around the pelvic floor muscles. Is there tightness? Is there tension? Is there any painful points? I want to feel a Kegel, so I want to feel how strong your pelvic floor muscles are, but it's not just can you do a Kegel. I want to know, can you do that repeatedly? Do the muscles turn on when we want? Do they turn off when we want? Can you do it more than once? Can you hold? Or does it just sort of fade out? So I'm feeling for all of those qualities, not just can you Kegel? Because I think that's what so many people just think pelvic floor therapy is Kegels, but it's much more than that. It's how are your Kegels? Maybe we don't need to do Kegels. And so I'm feeling for all of that when I'm assessing the pelvic floor muscles. And then we might work on it right then if there's tightness or something that needs to be worked on. And then the next thing that I do that not a lot of physical therapists do anymore, but I find it very informative, is called biofeedback. So what that is the sensors. So I use these sensors that go on the skin. Someone described it to me like an EKG, which is a good analogy. So it is like an EKG, but of your pelvic floor muscles, not of your heart muscles. So these sensors, let's see if I can hold all this and demonstrate it. So hold on. Okay. So again, this isn't a female, but a male would be the same. So the 2 red ones, they go on the skin outside the vaginal opening, or on a male, it would go like outside the rectal opening. And then this green part of it, goes on your thigh. And those pick up the muscle activity. And then on this little box, it's not going to do anything when it's not connected. But do you see this red line? That will correlate when it's connected to your pelvic floor muscles. So at rest, we want it to be like at the bottom. That means the muscles are resting. And then we can see like how high it goes when you do Kegels, and does it go up? Does it come down? Again, looking at the quality of it. Can you repeat it? So that's the essentials of a pelvic floor muscle first visit physical therapy. I also tell people, like, if you're coming in for something exercise related, then like bring your running shoes or exercise clothes, because we might look at those movements too. So again, there's a little bit of differences depending exactly what you're coming for. So yeah, if it's exercise-based, like leakage or pelvic pain, then we'll assess that too, or we might do more assessment of movement in general, or sometimes that happens on the next visit, depending sort of how much time we have. We might look at more strength and flexibility if it's a movement-based problem. And then it just sort of gets more specific from there. We kind of start treating what we find. Like I said, if there's muscle tightness, we're going to work on it. If there's weakness or incoordination, we might work with the biofeedback machine some more, and then we go from there. So that's sort of what happens in a nutshell, like sort of an overview, and then depending on what your specific needs are, we kind of tailor it to you. But it's good information for people to know before they come in, because some people are just like, I've heard about this, but I don't know a lot. So hopefully this helps kind of prepare you for that first visit. And again, always a reminder that for anyone this should go, but in my clinic, I always ask people, are you okay with this? Do you want to do this? And I always tell them, you're allowed to change your mind. If you say yes to a pelvic exam, but then you don't want to, like, that's okay. It's your body, your choice. So yeah, I hope that helps.